Okay, you can start.
走进去坐。
So 6 of you, right?
5.
Later we'll
We have another batch.
I think 1 or 2 colleagues will join.
Okay. Yeah, sure. So all of you are using the Onda. All of you know.
Not yet. For me, not yet.
Okay, all right. So, as I've seen, your Onda Pro is the first generation because for the Onda we have 3 generations. This is the first generation. I can say the oldest one. You have the biggest handpiece, big and heavy, correct? I agree with that. This is the first generation because the second generation is actually the handpieces are smaller for both the shallow and deep handpiece. And the latest version that we have, we call it Onda Pro. That one, 3 handpieces. It comes with a small handpiece or pocket handpiece for face treatment. So the latest technology of Onda now, or the Onda Pro, is actually for the face and any parts of the body. So that's the latest technology right now. So Onda is from Italy. Decca, the brand is Decca from Italy. They are based in Italy. And Onda is a microwave technology. So this is very different from RF, from ultrasound. Very different. I can say Onda is, because the technology is microwave, so this is actually stronger than RF and ultrasound. That's why the result with this device is permanent in terms of fat reduction. So your device, your Onda Pro, can do 3 indications or can address 3 indications. So 3-in-1 device. First is fat reduction. So as mentioned, for fat reduction, the result is permanent. Why? Because we are actually killing the fat cells with Onda. Because with RF and ultrasound, we are not actually killing the fat cells. Instead, we are just shrinking the fat cells. So for example, you do the RF or ultrasound treatment today, so your expanded fat cells will actually shrink, and then you eat again, or the patient eat again, sedentary lifestyle, no exercise, the chances of these shrink fat cells will actually expand or swell again. So the patient will go back to the size before the RF or ultrasound treatment. So in the case of Onda, we are not shrinking the fat cells, but we are actually killing the fat cells. We are the microwave technology can actually break down the membrane of the cell wall and causes the fat cells to suicide. Actually, we call it apoptosis, but in layman's term, we encourage the fat cells to commit suicide. That's why the result with this one is permanent. In each session for fat reduction, we can expect 5-10% reduction in size. So for example, you do Onda treatment today for fat cell reduction or for fat reduction. For example, on my tummy, I have, only example, I have 100 fat cells. After the first treatment, you are expecting to kill 5 to 10 pieces of fat cells. So in that case, after the first treatment, I'll have like 95 fat cells only. So are you expecting to grow bigger again, same size as before the treatment? Definitely no, because we are actually reducing the number of fat cells with this treatment.
睡住了还是
里面
睡着的都会流。
不会。
不会，它是血。
Okay. So second indication of your device is skin laxity. So first is fat reduction, next is skin laxity. So you do cryolipolysis here, right? You do? No cryolipolysis.
cryo 是不是那个
The fat freezing.
fat freeze？
Fat
Yeah,
freeze.
you do fat freezing, right? Yeah, you're using plateau. Because for the fat freezing, we are also killing the fat cells. But for fat freezing, no skin tightening. So we know once we kill the fat cells, tendency for the skin is to become lax or loose. So you need the skin tightening treatment to actually stretch the skin. So with the device, you can actually combine this with your fat freezing. After the fat freezing, 4 to 6 weeks after the treatment, you can combine with Onda for skin tightening. Or for example, you have a patient after giving birth or postpartum mothers, we expect skin laxity of the abdomen, then you can use this device. If you have patient who doesn't have much of the fat, but they have loose, saggy skin, you can use this device as well. So first, fat reduction. Second is skin laxity. Third indication of your device is cellulite. So very good for cellulite reduction. I know cellulite is not so common in Asia, but there are several cases, or I can say a lot of cases as well for cellulite in Asia. So the device can do cellulite treatment as well. And the the result is very, very good, I can say.
Okay, if do the Onda tightening, so how long can do the katu?
If you do the combination treatment, right? Actually, for the fat freezing, you have two options. For example, the patient has like soft fat, you can do plateau first, and then after that, because I'm not familiar with your plateau, I mean the downtime of this
4 weeks.
device. Yeah, so I can say after 4 to 6 weeks, you can do Onda for skin tightening, and then after that, you need to do another fat freezing treatment just after 1 or 2 weeks of Onda, then can do another treatment.
Okay.
Another case is, if you have, for example, hard or fibrotic fat, for example, quite difficult for your plateau to suck the fat because it's quite hard, you can do Onda first. The purpose is to soften the hard fat, and after that, you do the plateau.
Yeah, how long? So you just now say the
1 week.
Onda do first, after the 1 week can do the katu. So if do the tightening, how long can do, every week or every day can do?
Oh, for the tightening of this device is every 2 weeks.
Every 2 weeks.
Every
Okay.
2 weeks.
Can.
Yes. So for fat reduction, interval is 3 to 4 weeks. For skin tightening, every 2 weeks. For cellulite, 3 to 4 weeks interval. Yes.
Okay.
Actually longer than the typical RF because the result of this one is permanent. That's why we need a longer interval.
Okay.
So these are the 3 indications your device can do. And with the device itself, as you can see, we have 2 handpieces. We have one, we call it the deep handpiece. Deep handpiece because the penetration of your microwave is deeper, up to 12 mm penetration. And you have the shallow handpiece. 7 mm the depth of penetration. So basically your deep handpiece can be used for fat reduction. We also use this sometimes for cellulite, and then your shallow handpiece, we use it for skin tightening and also for cellulite. But you don't have to worry because the device is very user friendly. The machine can actually give you the preset depending on the indication you will do and the area of the body you will do. Okay, so actually that's why I said no need to do like a theory discussion, but just wanted to show you this. But this is the Onda Pro. So the Onda Pro has a small handpiece as well. So this is for the face. Right now what you have is the shallow and deep handpiece. So as you can see with the handpiece, why the result is permanent, why the result is better with, for example, RF and ultrasound. With the deep handpiece, as you can see, 80% of your energy goes to the fat layer of the skin. 80%, and the temperature on the fat layer of the skin is 50 to 55 degrees Celsius up to 60 degrees Celsius, which is the optimum temperature for the fat cells to die, to commit suicide. Okay, and you have 20% on the skin layer of the skin, which is for tightening as well. That's why when you do fat reduction, for example, I have pinchable fat on my tummy, you do fat reduction treatment, we are actually killing the fat cells. At the same time, we are actually tightening the skin as well. With your plateau, you kill the fat cells, you leave the skin lax or saggy. With the treatment of Onda, you kill the fat cells and also you tighten the skin at the same time. So the result will be better. It's just that this will require more sessions. Because with your fat freezing, like for example, we have our own fat freezing device, improvement is around 25 to 40% after 1 session. Onda is around 5 to 10% only per session. That's why recommended number of sessions with Onda is 3 to 4 sessions. That's why in every clinic we recommend you offer a package treatment to patient. Some of the clinics, they do like promotion 3+1 or 4+1 treatment, so the treatment cost will be less, and to encourage the patient to get the package, because definitely after 3 or 4 sessions improvement will be significant. Okay, with the shallow handpiece, 50% of the energy is on the fat layer of the skin, so we expect also tightening of the fibroseptal network, we call it, and 50% on the skin or dermal epidermal layer of the skin. So in this case, very good for tightening. We expect significant improvement for tightening of the skin. The technology, a bit technical, but just for you to have an idea, with Onda we are working with 2.45 gigahertz. What does this mean? Meaning we are actually delivering the microwave very, very fast, to the point that actually it doesn't see the skin, or it looks like the skin is like transparent. That's why most of the energy can go deeper the skin. Because with RF, right? RF, when you do the treatment, mostly the patient will feel warm during the treatment, warm to hot, sometimes to the point that patient will ask you to stop the treatment because it's too hot already. Very superficial. So with Onda, the energy can go deeper because we are working with the fastest frequency in the market right now. And Onda is the only technology being used for fat reduction, cellulite treatment, and skin tightening. But the technology, the medical microwave, they've been using it for 20, 30 years now for the treatment of cancer. That's why the treatment is very safe. So as you can see, penetration of the energy is actually goes deeper with Onda as compared with other technologies like RF and ultrasound. RF and ultrasound usually works in kilohertz to megahertz. Now with Onda, we are working with gigahertz. Absorption with fat is actually deeper. Okay, so with this one, so yeah, I actually made a comparison with RF and ultrasound. So RF can be painful during the treatment, can be hot. Depending on the technology, also heating can be very superficial. The result with RF, I can say, is like immediate. Immediately after the treatment, you can see tightening of the skin. But the result, will it last? Usually with RF, no. That's why it will require like every week treatment, every 2 weeks treatment, or usually every week or twice a week treatment in order for you to actually maintain the result. So with Onda, of course, the result is long lasting and permanent. Yeah, so for RF, it's very good for skin tightening. For ultrasound, the penetration of ultrasound is actually like you cannot predict where the energy can go. So sometimes with HIFU, if you've heard about the cases in doing HIFU, like they have muscle pain, they have locked jaw, because the ultrasound energy you cannot control. They go everywhere, the skin, and can penetrate to the muscle and up to the bones. That's why we have the side effect with ultrasound, especially with the HIFU, and treatment can be very painful, especially with HIFU. Okay. So in terms of the skin tightening, so we can see just 6 hours after the treatment, we can see contraction of collagen. So in terms of the tightening, we have papers to support that the Onda can do skin tightening. Immediately after, we see more contraction 6 hours after the treatment. And we can have production of new collagen as well. Okay. So on the target, so as mentioned just now, localized fat or fat reduction for cellulites and also for skin tightening. So this one not gonna discuss because this is for the face. And this, yes. Okay. So we go to the machine operation. So I know all of you knows how to operate the device now. I mean to turn on. So you have the emergency button here. So everyone knows how to use the emergency button, right? So in any case of emergency situation, just press it and shut down the device. Once everything stabilizes, you release it. So you have the arrow how to release it until it will pop out. And then properly turn on the device. I've seen you have these patterns. You know how to use the patterns? Not yet. Okay. So for example, I am your patient. I want to do my tummy. How will you do the treatment to me? How do you measure? How do you
check the CM?
A CM, the fat fold, right? Using the plicometer or the caliper. Okay, and then the treatment area. Are you going to do one treatment on me, like my entire tummy? or you'll divide, or how will you do it?
Divide.
Will divide into two. So for example, I am your patient, so you do one here and one here, correct? Or just one here?
没有学过我们
avoid that
我
one.
是做到完。
Avoid the navel or the belly button. Correct. Perfect. Correct. So in my case, what will you do if I am the patient? You will do just one treatment or two treatment areas?
one treatment.
One treatment the entire tummy.
Mm.
Okay. So that's why you have these patterns. Actually, this is your treatment area. So for example, I am your patient. Actually, I had Onda treatment 6 months after giving birth. I had 2 sessions of Onda, and the third session I had was last year, December last year. So 6 months after the treatment, after giving birth, you can actually offer this to your patient. If the patient is breastfeeding 6 months to 8 months, after that you can start treating with Onda. So this is your treatment area. So in my case, for example, you will do the treatment on me. So this is one area, and this is another area. But for example, you find my tummy, for example, I'm a bit slimmer, you can do one area here as well. If you have a patient, like bigger patient, sometimes you can do up to here, one here and one here, if the patient is big, and one here, one here. Okay, so this is your treatment area, and per day, per session, maximum of 8 squares only you can do. So for example, I am your patient, I want to do several parts of my body. So arm, this is already one area, 2, 3, 4, 5, 6, 7, 8. I'm done for today. Only 8 areas. For example, I have another areas. I want to do my butt. I want to do the back of my legs. You ask the patient to come back after 1 week to do those areas. But all the areas we did the treatment today, you ask the patient to come back 2 to 4 weeks, depending on the indication. Okay? Because there are like big patients, for example, more than 8 squares you can do in one sitting. But you cannot go beyond 8 squares. So ask the patient to come back after 1 week for another areas to be done. Okay? So what do I mean by this is your treatment area? For example, I am your patient. My concern is localized fat. First is how will you categorize whether you will do the treatment to the patient localized fat or skin tightening? For example, my tummy. For localized fat, you use plicometer or your caliper. So 2 cm or 20 mm above considered localized fat. Okay, so if you pinch the patient's skin, you get 20 or more than 20 considered you will do localized fat treatment. If for example you pinch my tummy, you only got 15 millimeters, then this is considered skin tightening. Okay, so 20 and beyond localized fat, 1.9 and below considered skin tightening. So also for the arms, because not all arms is only for skin tightening. Some of the patient, they actually have a fat fold on the arm area. So you really need to measure it with your caliper, and you decide what treatment you need to do based on the thickness of the fat fold. Okay? So for example, on my tummy, you got 2 or 20 millimeter fat fold, then localized fat, female. Okay, which area of the body? For example, my abdomen, lower abdomen, fat fold is 2 cm or 20 millimeter. Okay, so the device will give you the preset and also which handpiece you're going to use on this patient. That's why I told you the device is very user friendly. So in this case, 9 minutes and 43 seconds, you will finish in 1 square. So in this case, this is 9 minutes 43 seconds. This is 9 minutes and another 43 seconds. Are we doing the same?
Because we selling the one session is a 30 minutes.
One session, 30 minutes.
Yeah.
Will it depend on the fat fold or regardless? Like for example, all of you 30 minutes for the abdomen. So regardless the patient is small or big.
Each section.
Each session.
Mm.
Okay. But you still pinch.
可能是那个觉得
If do the tightening tightening the abdomen so 30 minutes can?
30 minutes because for skin tightening for example, skin tightening, lower abdomen, 8 minutes 20 seconds only for this. So for example, I am your patient, 8 minutes 20 seconds, 8 minutes 20 seconds. That is around what? 16, 17 minutes.
Oh.
for
Wow,
abdomen.
we do the 30 minutes.
Oh, 30
Then how,
minutes full abdomen. And then,
但是你刚才
Is it pull over?
so you charge per area, not per square.
Yes.
Okay, because actually the charging for the device is per square. So for example, you charge 200 Sing dollars, 200 Sing dollars per this. So if I am your patient, 1, 2, 200, 200.
Wow.
That is the charging. That's why we always recommend to offer packages to patient so you can actually lower down the price.
就是它还有调它的时间的。
有
That's
30
why you
分钟
have
咯。
this.
自己调哎，
That's why you have this.
Okay.
So,
调的。
哦，
so you also adjust the settings.
Yes.
You don't follow the preset of the device.
No people teach.
we
Just say,
need to- we
30
need to do
minutes.
until 30 minutes 嘛。
Yeah.
这边
So we need to follow.
Of course, we recommend you follow
Okay.
the preset of the device.
Never mind, I asked my manager because the day I asked her, she said, okay, selling the 30 minutes must do the 30 minutes. So don't know why.
So for example, you have a big patient, bigger. For example, double my size, still 30 minutes.
Yeah,
And
understand.
then you will do me
Also
also
30
30
minutes.
minutes.
So every single customer that buy that if every single treatment we doing 30 minutes.
Okay, so for example, your patient is double than me, bigger patient, right? So in that case, usually for big patients, we have 1, 2, 3, 4 squares. So for example, the fat fold I show you. So for example, very common for male patient, you do the abdomen, for example. Fat fold is around, for example, 4 or 40 mm.
Just only 10
10, 40 per this one.
So
In
it's a
that
40.
case, yes, 10, 10, 10, 10. So must be 40 minutes for bigger
for
patient.
4 sections like this. Is it?
For bigger patient, must be 40
Because 我们是以阿拉嘎 per session 30嘛，所以它这个是一个 part
很便宜哦。
yeah, it's
Actually,
very
almost
cheap
like 45
We
minutes.
doing very cheap. Is it?
whole
Yes,
30
and I
minutes.
can say can be inaccurate. Because if we are talking about bigger patient, you are actually doing underdose treatment. That 30 minutes is not enough if you have like 1, 2, 3, 4 squares. Because these 4 squares will actually take around 45
40
minutes. And you're only doing 30 minutes.
30 minutes.
Yes. If I am your patient, to me, the treatment can be overdosage. You can do over treatment on me for 30 minutes.
But we're doing lower.
Because in my case, only 16 minutes you're done to cover my entire tummy in the patient same size as me. But if the patient is big, especially for the big men, you are underdosing. The treatment is underdose. The result there will be a result, but not significant, or will require more sessions for them to see improvement. So I suggest, this is just a suggestion, you follow this one, and then for example, yeah, I think better you follow this one so you can have the correct treatment protocol per patient. Because of course the treatment is not like one size fits all. Like your treatment to me cannot be sufficient for bigger patient, for example, right? So you have to tailor-made your treatment per patient depending on the need of the patient. For example, you have a patient, for example, men, very common. You have patient with very big fat fold. For example, 6 or commonly 5.5, for example. 11 minutes, 54 seconds.
Oh.
So if you have another 4 squares, 1, 2, 3, 4, how many minutes is that? Almost 1 hour. And you're doing only 30 minutes. So will you expect result for big patients? I don't think you will get the result. So you really need to tailor-make your treatment.
If
Based
let's
on the
say
need of
the
the patient.
customer say, oh, very hot, I can adjust the power.
The power, actually, what we suggest is you stay with the preset for safety. What you can do is, for example, in the middle of the treatment, the patient says it's too hot already. You can pause the treatment. Remember, your handpiece is
For
full.
rest.
Yes. So you pause the treatment and then you glide the handpiece on the area, on your treatment area. This is actually will cool down the surface of the skin. And then after you count 3 to 6 seconds, and then you inform the patient, okay, I will start again, then do the treatment again. You don't need to actually adjust the settings, but you can do pause every
No
treatment.
need to adjust at all, right?
Yes, actually, we.
The
I mean,
result is not too much like if let's say I adjust the power.
It will actually depend. If you adjust, for example, the power. If you, for example, increase your power, this will be more hot for the patient. If you will adjust, if you will lessen the power, it will take
More time.
double the time for you to finish the treatment.
Oh.
Yes, it will be very comfortable for the patient. Definitely no hot feeling, but you will finish 1 square in 20 minutes. That's why what we recommend is follow the preset of the device. Just pause every time the patient is uncomfortable. Very common scenario is using the shallow handpiece for skin tightening. It's a bit hot, especially when doing the arm. Is it the same? Because in most of the
But we
countries,
can rest and we can go fast. Like that. Then got result.
fast, yeah, it's okay also to go faster. But you are using the old generation bigger handpiece. If you do
Yeah.
faster, you
My
will
hand will die.
you will get tired. Like after one patient, you ask your colleague,
Very
to other
tired.
patient,
Shagging already.
I need to
So
rest
you
already.
recommend rest more than compare with fast already.
Yes.
Then you rest lah.
Yes, you rest, you pause. What I'm actually doing is my technique is actually I start, for example, this is my treatment area. I start slow because the treatment is very comfortable, very cold at the beginning, right? So I start slow, and then after like 3 minutes, the heat starting to build up inside, and the heat is actually going outside the skin. So I start slow, and then eventually I will go a bit faster, and then in the middle of the treatment, I'll go a bit faster, also faster, but not fast that I will get tired after. And remember, you don't have to lift or to carry the handpiece. Just glide it on the skin of the patient, because if you lift the handpiece, definitely your hand will be dead. Will be
Because
tired.
this
pressure?
also very short like the wire.
Yeah.
Can take or
this
not?
one-
Very heavy
Cannot.
like that.
Yeah, sometimes I do this as well, or I lift the bed. Yes.
You need to pressure, like
Pressure,
some
no
pressure.
need for
Just
pressure.
just connect the
Yes,
skin will do,
just
right?
skin contact. Because your handpiece is heavy already. So if you do more pressure, then you will be tired. So just
If not connecting properly, it will like
没有，它只是
something
会
like
响罢了。
yes. You see the LED here? You see there's a light like this. When you're doing correct treatment, this will be green. When you are not actually skin contact, it will
Red color.
change to color yellow.
Yellow.
If you have 100% no skin contact, meaning you are actually lifting the handpiece, this will turn red.
if
Yes.
not connecting well, is the customer feel
Will get
uncomfortable
burn
or
or
get
not?
burned or get like like get like this stinging or whatever uncomfortable?
No.
No, no feeling at all.
Yes. Because if you don't have skin contact, I mentioned it will turn red, right? Once it turns red, it will cut off the microwave technology. Totally cut
off.
So you're not delivering any energy to the
Ah,
skin.
the minute connect, then we.
Yes.
Okay.
Yeah, that's why with Onda, no chances for. I've handled the first generation, this one. Since the beginning of Onda, I've handled 0 case of burn. 0 all over the world. 0. Because even, for example, you are like talking to the patient and you accidentally lift the handpiece to the skin, it will just stop the emission of RF. So no chances you can burn the skin. Yes.
But we cannot just
Unless-
only stop there, is it?
Yes, of course. You cannot stop. Chances of burning is less because it will cut off the microwave energy. Also, you have the contact cooling. You can see the cooling during the treatment is around 3 to 6 degrees Celsius. So less chances you can burn the skin. But of course, if you, for example, doing the treatment and you stay in one area, the patient will feel hot. Yes, because of the accumulation of heat. So always make sure you are moving. And you don't do circular motion when doing the treatment, only linear. Because when you do circular motion, you are actually overlapping the energy, more heat the patient will feel. That's why only
Only
linear.
zigzag.
Yes.
This.
Yeah, horizontal, vertical, horizontal, vertical. But definitely no
Circle.
circular, no circle.
But if let's say I do this area, right? And like that, can.
Yeah, of course. Just avoid the belly button. So there are patients like, for example, slim mummies, like after giving birth, they only have the bulk of fat on the center. You don't have anything on the side. Then you do the center. You do this. So in this case, you just avoid the belly button.
circle.
So
Circle
yeah.
can.
So here,
Sanjang.
or your circle, but your circle is not actually overlapping like circle, small circle like that. You can do
Big one,
circle.
big circle.
Yes. So this, or this. You can do that. Just avoid the belly button. Okay, so going back, you can discuss with your manager how you will do the treatment after the training. But I highly recommend you follow the protocol, the preset using your 15 by 15 square or using any of the squares, okay, for the treatment area in order for you to get the result that we are actually expecting with the device. For the slim patient, for example, I am your patient, 30 minutes, my whole abdomen will be overtreated, but I can see result after just one session. I will be very happy with the result after one treatment. But for big patient, you do only 30 minutes, the treatment is underdosed. The patient will not be happy after just one treatment. Because back home, we do big patients, and after just one session, the improvement is very significant. What we do is we follow this. So for big patients, as mentioned just now, so 1, 2, 3, 4. So we do this area, we finish around 45 minutes, almost an hour. We finish the entire tummy, but the result is significant after just one session. If you can see some of the before and after photos of Onda, after just one session, we see significant improvement. But of course, we recommend at least 3 to 4 sessions because the reaction of the skin will actually vary from person to person. I may improve the treatment area faster, but the improvement in your case, for example, may be delayed. So something like that. That's why we recommend 3 to 4 sessions per treatment for the Onda, for both cellulite, fat reduction, and skin tightening. Okay. So once you are ready to do the procedure, just press ready and then press the red button. Make sure when you press the red button, you are already in contact with the skin. Because if you press the button without skin contact, it will turn red. So the machine will detect no skin. Okay? And then, very straightforward machine. So very user-friendly. For cellulite, And skin tightening, no need to use the caliper. Okay? No need to use this caliper. Instead, for the cellulite, what you need to check is the grade or severity of cellulite. So you will base on this photo. So more grooves, it's grade 4. So less is 1. So you just have to base on the photo.
So what happens if some patients very greedy? It's only a bit, like maybe level 2 or level 1.
Okay.
They insist want to choose level 4. So how will insist want to do level 4, that number 4? So how is it okay or?
The treatment can be or I can say can be overdosing if you do that. But in this case, you actually inform the patient what grade you're going to use to the patient.
It means some patient will be very greedy.
Okay.
Maybe more than
They want more.
Yeah.
More
Right?
faster result.
yeah.
Okay.
Is it okay or
So,
cannot?
What I'm doing actually, if for example the patient, because I don't inform the patient what I'm going to use to them, okay? So what I'm doing personally is actually if the patient is like high expectation, the patient will expect after one session see improvement. After one session, no improvement, I will not come back to your clinic. I will not do the treatment anymore. So in that case, for example, the cellulite is only level 1.
Yeah.
I will jump to the next level, just the next level. But definitely, I will not do
Jump
from
Level
1
4.
to level 4. Definitely, I will not do that. But one step higher, yes, I will do that. So one level higher.
But
So
no
for
harm,
example, yeah, it's okay. One step higher is okay. One step higher is okay. So for example, level 3, you want to do level 4, then it's okay. It's okay. Just I don't recommend one jump to 4.
有牌照是吗？
Okay, so for cellulite, as mentioned, just choose the severity and the machine will give you the preset. Also, the handpiece you need to use in this case. Okay. So also for cellulite, 12 minutes, 7 seconds for this size. Or this size or this size. Okay. So for example, the concern is abdomen. This is I don't recommend also 30 minutes because each square is only 12. So for example, I am your patient, so this is 12, only like 24, 25 minutes. Okay, so any questions so far? For skin tightening, as mentioned, no need to do caliper, no need to use your caliper unless you are not sure if this is fat or just skin. So for example, your arms, so you pinch, as mentioned, more than 20 mm or more than 2 cm, definitely you will go to fat reduction. 1.9 below, skin tightening we will use. Okay? So for
How
example,
to measure?
okay, yeah. So in this case, this is your preset. So for the arm, how do you do the arm? How many minutes do you do? You don't do the arm.
Haven't done yet.
Okay. So because for example, for the arm, only 8 minutes 20 seconds per arm. So this is 820, 820.
So how about if 8 minutes 20 seconds, right? Both arm.
Then under those, you will not expect the improvement.
So
after this
we
session.
will charge each square is one section, like 200
Yes,
plus for
for
one
100
section.
Sing dollars for
So if let's say she's
one
doing
square.
both of these, so we will
Two
charge
session
like
ah?
2 sections for 400.
400 per one session. One
Per
session.
section.
So this is 200, 200.
200. 对啦
So
，per
you charge
area
the
lah.
patient 400 today just for the arms. I want to do this, another 200, another
So
200.
if let's say we're doing like one square here and one square here, like we're doing 2 times, then we will lose lah. Like 我们会亏本了咯这样。
哦，明明啊，we do the one part 13 minutes, so is
If let's say we're doing like hand
Okay.
we're doing here, but we're doing twice for
Yes.
this treatment,
Yes.
but we just only charge 200. Is totally
No, 200 or one square per arm. So this is 1 square, 8 minutes 20 seconds. After I finish this, I go back, skin tightening again,
Do again.
arm, another 8 minutes 20 seconds here, and another 200 Sing dollars. Yes,
他想我们损失啦，损失啦。
because the charging is per
Per,
square.
but we one area is a 30 minutes, so
So normally
only
we will-
charge one
There's only
pricing only.
one price that we charge.
Ah, yeah,
So
that's
we
why.
quite wow.
You're very generous. Your price can be very cheap.
So this one is normally we just wrap.
Yeah. So now, if you don't have any questions about the device itself, we go to the markings. How we do the markings. Okay. So who can be the subject?
谁要做？你要做吗？
哎，谁要躺下来？
我来 menses。menses can do or not?
Huh?
menses period.
没有，现在
Period.
So,
Yes,
okay.
can. It's just
menses
that.
period can ah?
Yes, but if the patient has period, you can do the treatment, but the treatment will be very sensitive. So you have to inform the patient if better to postpone the treatment, better. But if the patient insists, no, I'm okay, do the treatment to me, even I have a period, you do the treatment, but you inform the patient the treatment will be very sensitive. The patient can have bruising, they may be pain during and after the treatment.
Tightening
Because
also
Bleeding
ah?
will also
bleeding.
will more.
Can
the
be,
period,
can
the
be,
period.
can be, yes, because we are
first condition.
yes, because we are actually inducing heat, so the circulation will actually improve. So
If do the tightening also.
yes, any treatment on the abdomen area when
But other than that,
But-
can bring
other area is okay. Only the limitation when the patient has period is the abdomen area.
like
我要
some customer they have a fibroid or the any
几分钟而已
problem inside
8分钟而已
like can doing or not?
8分钟要发发。
Theoretically speaking, can because
okay lah,
your
这样我
microwave
做你给我去
energy only up to the fat layer of the skin, so it cannot go beyond fat layer. But if the patient has medical condition, what we suggest is a clearance from another doctor. So, for example, fibroid, myoma, for example, the patient has. We will ask the patient to give us the clearance that the OBGYN, ONG doctor is okay to do this kind of treatment to the patient. It's for our safety, but theoretically speaking, can. It's just that we want to protect ourselves.
孔风不可以。
Metal implant cannot.
On the area of the treatment area definitely has no metal. So for example, your patient has piercing on the belly button and you were doing the abdomen area, ask the patient to remove. If the patient has
And the birth control metal can birth control that one.
the metal on the area where the metal is, avoid.
不能
Yeah.
种子里面有东西，你要
它都是
接的那个地方有东西都不能。
戴耳环这些。
可以
If the watch earring,
No, it's okay, it's okay.
只是它你要做的
So for example, yeah, just going to do the tummy area, I have earrings, I have necklace, I have watch. No
It's
need to
okay,
ask
ah.
the patient to remove. And also the patient can use cell phone during the treatment.
Ah,
It's
okay.
okay, it's safe.
哎，
谁要躺？
那个绝密
For the contraindications, since we've started talking
它的是
about
停
it,
了是吗？
contraindications,
没有
metal implant on the treatment area. Okay. So for example, you're going to do abdomen. The patient has metal implant on the knee. It's okay. It's okay, but don't do the treatment on this area. Okay. So metal implant on the treatment area, it's a contraindication. If you have skin lesion or any skin damage on the treatment areas, for example, the patient has psoriasis on the abdomen and the patient wants to do the treatment abdomen, postpone. Don't do the treatment. Okay? Or the patient has cut or wound, postpone the treatment.
After give birth, like how long they can take the treatment after give birth?
Okay, 6 months. For normal delivery, as early as 3 months, can do the treatment already. For C-section, for cesarean section, 6 to 8 months.
Eh, jangan. Yeah.
I menses period, I do the arm hand.
Okay, sure. But can we use your tummy just to show how to do the markings?
我都不懂你没有来。
你也有咩？
我有顾客。
诶 second part 的都还没有来。
嗯
second part 的。
喏。没有啦，阿燕都来了，琪琪、阿燕还有 Yumi，你们三个哦。我的顾客都不有没有来。
Okay, ready? You have to stand up first because we're going to do the measurement. Okay. First thing to do, make sure the skin of the patient is clean. No lotion, no oil. Okay? Because these substances will actually react with your Onda. So make sure to clean the treatment area. So for example, may I have your name, please?
Chichi.
Chichi. So for example, she is my patient. So what I'm going to do, sorry. So first, so check. So in her case,
我要走了，我没有。
你们来。So you can use, it's okay to use the ball pen.
还要用这个画的，
因为比较
大概
standard 嘛。
的。
你不要画，你就大概
Okay to use ball pen. This is my first area. Second area. So like this.
做3遍，那我们是碰3个session还是会1个session？
这个其实是3个
因为
session。
现在语音是一个 session 30分钟，它的一个 session 是8分钟而已。
只能给他看 video，他没有上过这个学的。
我们的那个水我们一个 LC 一个 area 才10分钟，不是15哎，是10分钟，15我们还是做多啊。
他们做20个也是差不多。
现在更离谱30。
Okay, next is to measure the fat fold. So when I do, for example, in this case, the center, so I will not do the measurement here on the center, instead on the side. So from the bottom line here, and then this is my line, right? You can see the square. So bottom line and upper line, I glide until I get the fat fold. Okay, and then I measure. Sorry, ha. So 30. So it's here. So
it's
36. At 35. 36. There's a 38. 38 or 3.8. The fat fold is 3.8. So you see, I mentioned I measure like from the lower line, upper line, and then I glide. Because the difference is if I do this, I will get bigger fat fold. So we got 38 fat fold. If I just do this, only 30. The bigger the fat fold, if you get the correct fat fold, the machine will give you a higher setting, meaning the treatment will be sufficient for the size of the fat. Okay, that's why I don't recommend you measure like this. Instead, you measure like this. You get the entire fat fold.
So example, she now is 3.8.
Yes. So
Then the inch is how much?
关注肚子出来。
3.8. This will be 3.8.
中间的不一样哦。
所以
Cellulite also different
tightening or cellulite or
In your case, fat reduction, because fat fold is more than 2, more than 20, localized fat, localized fat, because more than 20 the fat fold. So even if you see her skin is loose, but you have the pinchable fat, 3.8, then you do localized fat.
So the side what?
The side, okay, ha? And then if you are doing like more squares, I suggest you draw, so that you know what is the fat fold per area. For the side, so I go to the center, lower line, upper line, and then I glide. Sorry. So this is 16 only. So this side is only skin tightening. Okay, because less than 2. So this is only 16.
因为我们以前做通通错完，通通
我们都不是专业的。
Side. Check
我们
myself.
进来就让他去。
This is
40以为，你旁边比较少。
sorry.
我以前肚子几大，你懂吗？
This is side is 17.
这边要tightening。
tightening，哇这样。
Tightening fat reduction or localized fat.
And never mind that, see the this part.
Hmm?
Later try here lah.
Yeah, sure.
So
So
like
for
that
the-
lah. If let's say got fat, we adjust local fat. Then if let's say one tightening, then we adjust tightening lah.
on the same area.
No, the waist.
Yeah. So
tightening.
here, this is localized fat. You use localized fat. And then for the sides, you use the tightening.
Tightening. Oh.
Yes. You have to adjust. So in her case, for example, you will do like 30 minutes full abdomen, right? That's what you're doing, right? Okay. Understood. Okay, so in your case, localized fat, let's see how many minutes. So this is 3.8. So 3.8. So 10 minutes, 15 seconds, and then on the side,
他是要一个一个自己
820, 820. So 16.
27
plus,
So actually this customized machine customized machine.
Yes. Yes.
27还和你是做的不是同一个。
等一下哈，要实话。The first one, can you rewind?
Okay. Back to home.
Okay. Localized fat is more than 2. Trust localized fat.
2 and more.
Okay. So
2 and more,
tightening
20 or more.
Okay.
Tightening is 1.9 below.
Cellulite?
Cellulite, no. You have to measure the grade of the cellulite.
Cellulite 是看那个 use the eye to analyze
Yeah. Just look at the cellulite, the wave of the skin. And then
But
you
if
will be...
let's say we don't know how to analyze.
Actually, this is very like I can
Common.
say very easy, because anyone who has cellulite.
Me. Me have cellulite.
Okay. Do you have a doctor here? Where's the cellulite? No
这边
cellulite.
啊，这边才会有 cellulite 啊，cellulite 是直接看到的。
In Asians, commonly the cellulite is on the leg.
Hello，
Oh, you very.
来，cellulite 啦，看到吗？凹凸了，
The
所以
one
这是
one
cellulite。
one. I got a lot of cellulite. Actually
这个就是
normally at
蛮不
the
多啦
back. 哎，录影哦。
肚子都录了，那腿不能录。
Yeah. See, yeah. Actually, yes, I agree. You have, but this is very very superficial, very shallow wave. So in her case, I will only use one. In her case, only one.
你
Yes.
穿回裤子了。
Like if the cellulite is not so visible, very shallow waves only, just go 1 or 2.
But tummy got cellulite.
Yeah, also, yes.
How to
Can have.
tummy 怎么看？
Although for Asian, cellulite is not
很
very
少，咱们
common.
会看到 cellulite。
what I suggest, if for example, most of the patient will not come to you like, I have cellulite on my tummy, and then just do the treatment for my tummy. Commonly, what the patient will see on the tummy is laxity and also the fat fold. So in that case, you think the patient has cellulite on the tummy and you have the fat fold as well, just go localized fat treatment. The patient will be happy with the result. Actually, this is the trick, when you actually do localized fat treatment, because you are using deep hankies, 80% of the energy fat layer, 20% on the skin. Actually, when you do localized fat treatment, you are killing the fat cells, you are also tightening the skin, and you are also improving the cellulite just with this treatment. So for example, your patient has everything in the tummy or in the leg, I will always suggest you go fat reduction, localized fat, because it can address 3 indications already.
But no need to measure.
I still
You
have
just
to
take a
measure.
look then.
You still have to measure. As mentioned, if you have the 3, meaning you have 2 centimeters and above fat fold, then like in her case, we see the laxity right on the center. We have the laxity, but we have the fat fold as well. Then we do localized fat, and the localized fat will also improve the skin laxity. In her case, on the side, because we're going to do skin tightening only, right? We are not expecting reduction in size. We are not expecting killing the fat cells on the side, because we are using the shallow handpiece very superficial, only for tightening. But here, we kill the fat cells, we tighten the skin as well. If there is cellulite, for example, it will improve the cellulite as well.
Okay, let's start.
So for the arm, sorry just wanted to show you the measurement for the
like that or put like that.
for the arm. Okay. Because actually with DECA, what they recommend is to do this. Patient face down and do this. So you put a towel here and then just linear. Or some of the patient will not be comfortable face down, so they will face up and do this area. But the problem is if you do this, you can miss this area. If you do this, you can miss this area. What I'm actually doing is the patient face down. This is a trick. Face up, sorry, face up. Face up. Face up. If you are already comfortable with the treatment, what I suggest is patient like this, put a towel here. So the patient will have something to place his hand like this. And during the treatment, I hold the elbow and do the treatment like this. So I am covering this area, and also this. Some of the patients, they are very concerned here. They have the laxity here, this area. And most of the time, we actually forget to treat this area. So with this technique, you can actually cover the entire arm, even if this is the concern of the patient. So I do like this. This is like improved technique. But the basic one is either face down like this or face up like this. So I suggest you start using either face up, face down, and then later on you do this. The result will be better if you do this to the patient. So you cover the entire arm. Okay, and then we do the hands-on for the abdomen. So for her abdomen, of course, we start with localized fat. Okay, for abdomen. Okay. You don't have any lotion, anything on your skin? Okay, perfect. And another thing, this is very important, before you start the treatment, make sure your temperature is below 6 degrees Celsius. In this case, now is 13.4. Cannot start the treatment. Okay, cannot start the treatment. Must be below 6 degrees Celsius. You have to wait for this number to go 6 or below.
For me to open first.
Yeah.
Okay.
Yes, because if you start, for example, 11 degrees Celsius, you start the treatment, the temperature will be up. So the cooling on the surface, it's not very good. Yes. So if you want comfortable treatment for the patient, wait for 6 degrees Celsius or below before you start. 9 definitely cannot start yet.
Don't need to press anything, right?
Yeah, no need to press. When you go here, usually the temperature is like this. So you have to press here in order for you to see the actual temperature of the handpiece. So this is the temperature here. Okay? That's the temperature here. So you have to wait 6 below. I do few passes on the abdomen, and then any one of you would like to continue doing the handstand. Can I have gloves?
Oh, lah. Box.
Below, yeah.
And what is the fluid you are using? What is this you are using? Mineral oil? Is this mineral oil?
This is
Oil,
the Onda
yeah,
oil.
Onda oil.
Onda oil. Yeah. Where do you usually buy your Onda oil?
I'm not sure. I need to ask my manager.
The machine got oil, then we use.
Ah, okay, okay.
第一点你的感觉吗？
弄那边。
我要用那边的。
哦，你要用那边的。
我不会了，
这样我用这边。
So in her case, we have the existing
Yeah,
redness
that's
or
it.
broken skin. I will avoid this. So I will not pass over this.
这样我去。
Okay. So now is 4.3.
Yeah.
Because this is the handpiece I'm going to use.
Yeah.
So oil. You see the moisture, the water on the handpiece.
Yeah.
Before I proceed with the treatment, I make sure it's dry. So you don't have water on the surface of the skin. So you don't have heating on the surface. So I dry it. Ready. Now it's 6.7. 6.6. Have you tried the treatment? This treatment already? First time? Okay. So what to expect? Cold in the beginning. In the middle of the treatment towards the end, cold on the surface, hot inside. You will be confused what you are actually feeling. Okay? At any time you find it uncomfortable, you just have to let me know so I can pause. Okay? So 5.1. Okay, it's cold, huh? Sorry. 1, 2, 3. So in the beginning, I start very slow. And you don't have to lift the handpiece, just glide the handpiece on the skin. So you will not get tired during the treatment.
没感觉，
还是冷，
真的。
没有太烧。
Very comfortable,
Still
right?
cooling.
Are you allowed to do the treatment on yourselves? Are you allowed to do the treatment on yourselves? Because you can actually do yourself.
If we over this thing, what will happen?
Because we are actually heating up the skin, it will become more red.
Because
Yeah.
if got one customer body also have rashes like this, then how to avoid if got many dogs?
Then I suggest you ask the patient to postpone the treatment. Let the skin recover first. Once all the red dots healed, then you do the treatment. Yes, because the concern is that after the treatment, all this red become redder, become swollen, more swollen, then the patient will blame you. Because you do the treatment to me, you do the Onda on that area, that's why now it's worse. Right? So for your safety, I suggest you postpone the treatment. In her case, still okay, still acceptable. But if scattered more of like this, I will not do the treatment. And also, you don't have to look at the monitor from time to time. After it finished the time, it will automatically stop.
他做到很轻松，我觉得很吃力这样。
真的哦。
Oh, okay.
他没有用力，他没有压下去的。
我们做到好像一口这样抓住一口里面出。
You find your comfortable position every time you do the treatment. Some of the therapists, they find it comfortable sitting down. In my case, I always prefer doing the treatment standing.
Sit eh.
Yeah, of course. So for example, you have the chair, you think you're more comfortable, you can.
可以的哦。
因为它是一个板过来嘛，它不是
因为我们之前不懂，跟有人教，然后我们就30分钟，
是啦，不一样啊。
那你们直接调时间看。
不是，因为上次他们教的是调时间，可以按 stop 吗？我也不懂。
How is it still comfortable? But I started to actually move faster now because I know the heat is accumulating.
5点多还是
In 5 minutes, someone wants to take over. Someone wants to continue the treatment.
对吧？
刚已经做到半死。
来，你们发一
哎，什么感觉会烧呢？
我也不知道烧了。
haven't feel hot yet.
No, still cold, still cold. Okay.
Because we're just like almost halfway done. And at any time you're having like difficulty moving the handpiece, just add oil. So you don't have to like glide it.
Yeah, for me it's like that lor.
No lah.
I feel tired.
Yeah, just add oil and then now you can move smooth again. Yeah.
Because
That's
I
why-
feel this wire is very short.
Oh, okay. But for the height of your bed, to me it's okay. To me it's just
I
okay.
need to
You need to practice. Position the.
upgrade myself. first.
You wear heels.
Like adjust everything.
You can also adjust the machine. Like what I actually did. Sorry. What I actually did. Just now the machine, the monitor is facing the door, right? So I actually rotate the machine because I'm using this one. So this handpiece must be closer to the patient. So I don't have to pull the
Yeah.
cable. So if I am using this handpiece, then I will move again the machine so that this one is near my treatment area. Yes. So you have to move the machine as well for your comfort.
Because before that nobody teach
Yeah, I heard.
teach us.
You just self-learn, right?
Yeah.
用这样出力点，他完全没有力，他贴着就可以了。看到好沉重哎。
它很像只是在 surface 这样。
那个要坐下来。
She has more pressure than me.
Yeah.
Okay.
Actually need pressure or not?
No need. Because the handpiece itself is heavy already. If you put more pressure, your hand will be
自然的
dead.
就是这样放着这样推手而已
You'll get
你
tired.
只是帮忙推它而已，不用去出力
我。看做很
帮
轻松
很累哎。
这样
我 OK，你不 OK，我觉得你好像用很大力再这样子。
没有啊，
Just
那
like
个
the
要
hand
低一
piece.
点啊，这样过来。
这样你就是轻松的。那你站起来可能就是
对，这样全
压的，
行，你这样子就 OK，就 OK。
这样就自然。
坐住咯，可能你有椅子坐
以后
住。
你就可以坐着了。从头到尾都是丢到人的，没有丢到烧的。
Because I do the pap is not like this very small, right? I do the wow, the
Yeah,
pap
the
is very
whole
big and like
area.
that.
Oh, okay.
So
Understood.
maybe feel tired like.
Okay. So you can try doing this
Yeah,
technique
try.
square by square.
Yeah,
Square by square. And your movement is also the same, right? Slower, or you do faster.
Fast.
Fast.
Because customer say very hot then I just
Okay.
Yeah.
Yeah. In the middle of the treatment towards the end, they will feel hot, right? But the more you move fast, the more you get tired after.
tired.
Yeah, it is tiring.
Oh.
You stay inside your spare only, huh? Because you have another spare here, so another treatment area.
But still feeling cool,
No,
not hot at all.
full one.
It's still cold? No hot feeling inside?
Why?
Maybe because your tolerance for heat is higher, or pain tolerance is higher. That's why you're not feeling. Usually, abdomen, localized fat treatment, you won't feel the feeling, the hot feeling. Still comfortable, bearable. But when you do skin tightening, because shallow handpiece, very superficial, the more you will feel the heat. Yeah, so later you'll feel the difference when you do this on the side. You actually have a stool here. Would you like to sit down?
It's okay, it's okay.可以穿一下，但是叫你做，看他好像很容易，但其实也是会有重量的，只是要推过来。
真的。
How much do you charge for the whole abdomen for 30 minutes treatment?
Package is 150.
150 whole abdomen, 30 minutes.
价钱出来啊？
我不懂啊，因为我看他们的那个10次、30次吗？20次吗？3000块，不是一次150。
package 啦。
Package 吗？Per session I don't know.
Your package is how many sessions?
10 session.
10 sessions.
对，还是30，20啊。
10个legacy 10个这个。
还在冷。
冷。他讲那个感觉是正常的，他讲只有改变才会知道。
Like this, if customer won't feel hot, no need fast one.
Yes. Just do it slowly so that you won't get tired.
Hot 比较好。
Done.
Need to press on it.
You need to press, yeah. Already stand by. Now still cold, and then let's wait for a few minutes. After a few minutes, you will notice the feeling hot on the outside.
你是有烧的，是烧的。这边冷啊，
冷。
这种是when I touch it, it's heat a bit. 给它 touch 一个
Yeah,
跳一点
it's。starting to heat up.
来，稍
The
等。
heat actually going up now.
这边因为是我们很早走到这边，是因为你有那个2个 dot 在这边嘛，烧的其实是
Yeah,
烧。
here already getting hot. Okay, see? You set for me the skin tightening. So for the sides, this skin tightening. And first the two.
对，屋子那个，skin 的这
Skin
边。
tightening. Feel.
OK。
Abdomen also. Okay, so only 8 minutes 20 seconds per side. So this is 820, 820.
没到我做。哦，那个。
做。
你要穿吗？
对，
你要穿，你一定要穿。
我 try in
快，你看你这事情多了，快点，快点，不可以，快点，我要穿，你现在已经快点，try，快点那个戏了，我怕。